Allison. My name is Tina. I'm going to be your nurse. I'm going to be performing a physical assessment of your lungs. I want to provide some privacy, so I'm going to close any curtains that might be available. I'm going to ask Allison to identify herself. I'm going to use two forms of ID. Allison, can you tell me your name, please?
Allison Brown,
Can you spell your last name, please?
B-R-O-W-N.
Okay, and I'm comparing that spelling to her wristband. Okay, next I ask her date of birth.
11-190.
Okay, and I have that in my chart, so I feel comfortable that Allison is Allison. All right, I want to wash my hands. I'm just going to use hand sanitizer. You can mock wash your hands, but you probably, because you will be touching a real person, want to do a real hand wash. Okay? Okay. You assemble your equipment. You need a watch and a stethoscope. All right. I'm going to use the clock because I don't have a watch on. I want to make sure my hair is not going to get in the way, so I want to tie my hair back before I do an assessment. All right. So I obtained a proper history. Allison, can you tell me why you're here today?
I have a cough.
When did the cough start?
About 2 weeks ago.
Okay, 2 questions. That's all you need to ask. And I'm trying to follow this exact. Okay, so as I'm talking to her, I might be counting respirations. I'm not going to stand here like this and do respirations. That's something that you want to do while you're doing other things, so the patient doesn't get conscientious and maybe, you know, breathe a little lighter or shallower where you can't count it properly. Okay, so if I counted your respirations, I counted 12 respirations. That's a normal finding. I'm going to jot that down on my sheet. You're not going to have this particular sheet with you. You can use piece of paper, though, to write that down. All right. Next, I'm going to look at the posterior chest. I'm going to, as it says here, inspect and estimate the anterior transverse diameter. This is visual. You don't physically have to go like this with your hands. Can everyone see me? Okay. But your transverse should be 50% of posterior anterior. That's a normal finding. I'm going to be also, as I'm doing this, looking at Allison's skin. I'm going to be making sure that there's no gaping wounds or there's no lesions, no bumps. I'm going to note if there's acne. I'm going to note if there's different dry skin conditions, things like that. Okay. And next I'm going to palpate for lumps and tenderness. Okay. And that I'm going to do. Okay. And I'm just going to go down like this. And then I would do the same on the back. Okay. Checking for lumps and bumps and anything that doesn't belong there. Then we want to check the symmetric expansion and tactile fremitus. Okay. So if I could have you repeat the words 99 for me a couple times.
99, 99, 99, 99, 99, 99, 99.
Okay. As I was doing that, I was also feeling for lumps and bumps as I was going down the chest wall. Okay. So when I'm looking at the tactile fremitus, I'm trying to feel for symmetry, making sure it's the same on both sides. Okay. So that's like the big thing. You want to make sure it's the same on both sides. Next, I'm going to check the expansion. So I'm going to go underneath. Okay. What is this called? This area here? Costal angle. If you could take a breath for me. One more. I'm just going to exaggerate it for you. And it's equal on both sides. Okay. Next, I'm going to percuss the lung fields. And these are gonna be the same spots that I'm gonna be listening in. Okay. So I wanna do, if you need to get closer to hear it, you can come closer. Okay, again, we're in the clavicle, this is gonna be a real flat sound.
I've been doing this 100 years.
You have
And
great
so if I
technique.
can just, what I do, now remember I'm left-handed, or, yeah, left-handed. When you put your finger, I kind of push it in.
Oh, nice.
Are you okay? No, it's, you know what, she's okay, yeah, she's okay. And I'm going above the clavicle into the air space. And then I'm comparing left and right. Now, did you hear? It's different as I'm going down, but the same left to right. Women,
Breast tissue.
rest in the way. You're
got
not
your
going to be able to
sternum.
tap on it. So I'm gonna, are you able to kind of just push your underwire out? And then the sides. So you're listening, you're comparing the sound from left to right. And the way I made it loud is I pushed my finger deep in and I don't have my hair back, so. I'll be videoing, I'm sorry.
So then with like heavy set people, you just,
Heavy set too. You just kind of, this finger, I push in, and that helps to create a better sound for you.
All right.
Just had to get,
No,
I'm like,
that's
oh,
awesome.
because you guys will be quiet, and I know it's the push the finger in.
Do you think, like, because I know some people use 2 fingers sometimes, and then I've seen people use 2 fingers.
You can, but you know what? To me, it's that if you're able to get that one that you're gonna tap on, push it in, and it's like you gotta learn. You gotta be able to keep it flat. So it's a weird. It's almost like an exercise. And then tap. And I sometimes I do